Representative Marguerite Quinn.
Thank you very much for being here today with us. I have a couple of questions. The first one I'm going to have just as a real quickie. Under your GGO line, what are those basic expenses? Am I correct that it's your payroll, your health care, and pension is basic?
Yes.
I don't expect you to have it now, but would you be able to come back to the committee with the increase of, on those three categories, where the increases lie to make up the 2.36%? X amount goes towards payroll, it's a whatever percentage increase in health care benefits, and yet another % increase in pension.
Sure.
Thank you.
Thank you.
What I'd like to focus on, Madam Secretary, is the Department of Aging, your Go Time projects. I believe we just got this morning, and as I was looking at it, you know, I got a couple of questions that come up. The project called Increasing the Reach of Mind Matters. Is that new?
The program itself was introduced 2 years ago, I believe,
Yes.
and right prior to my coming on board at the department. And Mind Matters is an opportunity for us to partner with an organization that many of you might be familiar with in the community, a WITF, a local public broadcasting company, in order for us to do a couple of things that we really need to do in order to better support senior community centers first and foremost, and then other opportunities we have to work with other agencies to tap into these programs. So what are those programs? We are required to provide within our senior community centers and in our local communities education, wellness programs, and it runs the gamut from professors who talk about various points of interest within the Commonwealth of Pennsylvania and across the country, but any educational program that's going to impact a life of a senior in terms of their quest for desiring to have more information about a particular topic. Well, in our senior community centers, there's a lot of money being stretched to do lots of things, and sometimes programs take a little bit of a hit. I know that from my day of serving as an area disability aging director, that you just have to find a more creative way to provide educational wellness programs. So Mind Matters is our opportunity to streamline that information into senior centers across the 67 counties of our Commonwealth. The money savings is that we don't have to have physically a person going to a senior center to provide the program. So it's also allowing us to take advantage of technology and better use of it to provide the educational wellness programs we're required to provide.
From where does the mandate come that you have to go out and educate? I'm very close to my senior centers, and I've never been aware of a program that they have someone coming in from the state to educate.
It's not mandated that the state sends somebody physically into each senior center to provide education and wellness programs, but it is mandated within each county, within each planning and service area, under the Older Americans Act, that we have at least one senior center in each planning and service area. Those senior centers are required to provide services. Part of the services is a congregate meal, and the other services is health and wellness programs, and education programs falls within that. So this is our opportunity to provide a service to those senior centers, and it's funds that they don't have to expend. It's an investment on our end in order to help them meet the educational goals within their senior center setting.
It's presuming they have a big screen TV or computer network system to pick up on this, correct?
To be certain, there are limitations whenever you engage in streamlining, but we continue to work with senior centers. Many of them I've been impressed with their capacity to make do with what they have, or to ensure that we're working with them, such as through the Senior Community Center grants, to provide them with opportunities for upgrades where they need it.
I see that you have savings for it, but I don't see a project cost.
The initial project investment, I believe, was 30. Go ahead.
The cost of the Mind Matters contract is $42,000 to do 10 educational sessions.
So that's production, but getting it out to the field, auditing to make sure that they're being given, making sure that they have big screen TVs or whatever it is to receive them?
That's included in the entirety of the contract with WITF.
Under the $42,000, how many of these programs have been developed already? Filmed?
We have filmed. I'm sorry, I'm doing the month of the calendar months in my head.
Okay.
We started in September, and we've done up through February of this year.
So there's a new one every month?
There's a new one every month.
And I see that includes like history lessons.
Yes.
Where do we see them to see what's going out?
we can make them available.
Yeah, we can make them available. We also, for senior centers that don't have the capability of a high-speed internet to participate through the live stream, we make available digital copies on discs that they can also view at other times, and we have those available that we can obviously make available to you.
So you are anticipating $42,000 a year in expenses to produce these? Like that's an annual contract?
Right now, the contract runs just through this June 30th, and after every session, we evaluate the feedback from the senior centers to determine whether they like the program, the value of it, and we'll take those into consideration before determining if we want to extend the contract into a future year.
Did these programs then supplant an actual person from going out there? Is that where your savings are in? I don't ever recall, and I spent 8 years on the Aging Committee, being notified that, hey, we've got someone to come into your senior community, senior centers and give a talk on history or health. I mean, I know there's things that go on inside, but they're germane to what's the community, the toe tappers don't come down from Harrisburg to promote agility and...
If I misspoke with regard to someone from the state going into each senior center, that is not what I meant to imply, so I apologize if I miscommunicated my message. With regard to our opportunity at the state level to work with local area agencies on aging, typically from what you just described, your work with the Aging Committee, you might be more familiar with Primetime Health, and that's been a program at the local level going into many senior community centers to provide health and wellness programs such as healthy aging and falls prevention program, diabetes programs, and the like. That support, while it comes from the state office, certainly is then, titrated down to the local level. That might be something you're more familiar with. When My Matters came about and how it was described to me when I landed in this privileged post a year ago, I too was skeptical in terms of how is this working? How is it? What is it worth the investment? How are these senior centers going to ensure that they can have access to these programs and services? So we continue to ask those questions, why we see it as an initiative that's been positively received thus far by members who are watching the videos, as well as senior center managers across the Commonwealth. No differently than our senior community grant programs, senior center community grant programs, we need to ensure that we're engaging in continuous quality improvement efforts and reviews to make sure that it's going to achieve the results that we anticipate.
And I agree with you. And my skepticism is not regarding the program itself. It's regarding how does a program and expanding a program and an annual cost show up on a sheet that's go time, transformation, innovation, management, and efficiency savings. That's where my question was.
Sure.
Now, let's move on to the other one, the modernization of the Aging's financial reporting system. Could you speak to me a little about that?
Sure.
What's this? I see what the system was already, but will this be part of an enterprise system that you have yet to have developed?
We are working with folks within state government with regard to the current very antiquated system that we are using on the IBM AS400 that really is not conducive to us within the department, but also it's not very helpful to our local area agencies on aging. So working within other units of state government, we are exploring opportunities that we have because we know that it's going to be a continuous large cost to us to maintain moving forward. So we're in the very early stages of our development with that. Just had recently an RFI out to get some feedback from vendors who might be interested in working with us on it so that we can move to a system that's going to be more conducive, more productive, more reliable, and more efficient for our local area agencies on aging in particular.
I understand that at the end of a total purchase, implementation, live, that we're able to quantify savings. But what confuses me is that, for example, yesterday when we spoke with the Department of Revenue, their project, their information system update doesn't show up on a go time savings sheet. It was in a whole other columns, and we had a number of testifiers or a number of legislators on both sides of the aisle asking about those ongoing costs. With revenue, we're years in, and there's $100 million. I forget the figures. They weren't as dramatic for Treasury or the Auditor General, but they were major investments. So to have this instead of on the major investment, but as on a cost saving, I'm confused. And because those major investments in terms of technology, you don't see, as my understanding, those cost savings for years out until you've put out the RFPs, got the new software, hired the implementation firm after that RFP process, and then get into the grueling the whole implementation process before live. How is this on your savings, whereas other departments, it's in their major budget expenses?
Yeah, I really wouldn't feel comfortable responding on behalf of other agencies, but as far as our particular agency goes, as we were asked to take a look at what initiatives of cost-saving measures that we have, these were two items that we felt were appropriate to list as our go-time initiatives.
What is the project cost for this?
For the second one of the
Correct.
financial reporting system, it's a $1.3 million investment.
Is that for the software, or is that the implementation, or what? I can't imagine
Sure.
why there could be such a low cost when we've had many other agencies in front of this committee over the years that we were talking hundreds of millions of dollars.
Sure. I would.
The price estimate is based on some of the feedback that we got through the RFI process and talking with different vendors. That would include the system as well as any modifications that we would need for that.
But not implementation.
Not necessarily the implementation.
Because in a past world, I worked for an implementation firm, and that's really where the dollars are. So I would suggest to you, before we look at the potential savings, that we really get our arms around what the full cost of this project is. I'm not saying that it doesn't need to be done. An IBM AS400 sounds like it's old. I take your word for it, but I think you might be into some expenses that you're not quite anticipating yet. Thank you.
Appreciate that.